Please feel free within this moment to close your eyes and take a minute to just think and breathe. Within the short minute, in the beginning of the song, your body has been reacting to the music. Some of you in many different ways. Some people remember a memory, a past idea. Some are like me and my grandmother with Alzheimer's who loses her memory easily. You remembered an image of your past somehow. Those of you who may think, nothing felt like it happened to me, your breathing pace may have changed to relax. Your heart rate may have changed, which also changes your blood pressure within time. Easy. Today, I would like to explain how music therapy could benefit a patient's mental and physical health, which is why this has been used for generations. The art and performance of music therapy has been taking place since Greek mythology and within the Native American medical history. On the Peterson Family Foundation, an article stating health benefits of music therapy explains the history. We have been using this since World War I and II. Though we have been using it far back, this is where we see the big blossom of music therapy and how we use it today. Volunteer musicians would go out to the battles and play music for the soldiers, the wounded, and the veterans to help relieve stress and possibly help them forget or move on from PTSD. Due to this big change and the visual of progress within the soldiers, doctors began to hire musicians because their patients started to explain that their wounds began to hurt less, or there was a healing quicker than the doctors had expected. Today, music therapy is seen most often within hospitals and especially among youth. To become a music therapist, you must attend a college for at least 2 to 3 years and follow the guidelines to become a music therapist. The reason for this is that music therapy is still a type of therapy and could possibly prevent suicide or any negative thoughts that would cause hurtful harm to a patient. Besides the degree, a basic knowledge of music is necessary since not everything works for everyone. Some people may have felt a really big change just in the 1 minute that I played the music. Other people may have felt nothing because they would react better if they were playing the instrument or if they were learning the song or writing their own music. But the patient should not have to know how to exactly write music, which is why the therapist must know. Therapists must take action knowing that their weakness could be the thing that changes someone's life. They must ask themselves, not, what am I best at, but what will benefit this patient? The benefits of music therapy within patients is why this art and medical form has not vanished after many generations. It can relieve stress, not only among patients, but among people. Many of you in this room probably listen to music in the car. That's a pretty lenient example. The reason for stress to be removed is that it can cause many harmful things some that even doctors don't know of yet. An example of this is a headache, body pain, including your organs such as the stomach, anxiety, depression, outbursts, social withdrawal, and many more negative effects that doctors are still studying today. As I mentioned before, within that minute, your heart rate may have changed, which overall affects your blood pressure. So many therapists use this to help blood pressure, whether it's too high or too low. It may also remove some body tension and improve the effects of prescribed medicine. This has been shown throughout patients with cancer, especially children. The pain is nearly unbearable, even with medication. The music not only draws their minds away from the pain, but it also helps the medicine improve due to the connection to the brain. Excuse me, I think they need to turn back on. So music therapy actually links to the brain itself. And this is a good example right here because it generally affects the brain as a whole, but not every specific part. Over here, if you see the check marks on pitch, it is because certain parts of the brain are affected by the pitch, which is how high or low how high or low the sound is. Some of it is affected by rhythm, which is 1, 2, 3, 4, or 1, 2, 3, 4. The reason your brain does not connect to everything is because different parts of the brain are meant for specific things of your body, which is why some people have the urge to tap their foot to the rhythm, but your foot cannot sing, so your foot almost never remembers emotion. Music is also used to remember emotion. Most patients are seen here in the anger to boredom section, which is the thing that therapists usually want to drive away. Boredom usually ends up reaching to relaxation, but of course it can reach to enjoyment. It's just a bit more difficult, and the transaction is smoother for patients to go from one to the other rather than across the diagram. So an example of some different things over there, in case it's hard to read, is amplitude. Round or sharp may affect if you feel sad, pleasant, or happiness. And so therapists need to think about this before they choose a song, because they may think to themselves, this song makes me happy. But if it sounds by amplitude too loud to the patient, they might have a panic attack. And this is something that was explained on the website for psychiatric and music in the Indian Journal of Psychiatry. An important example of this could be, let's pick one. Let's do pitch level. So for high pitch level, it may seem surprising because it is very high in range. Usually that is explained as sopranos, which is what I am. So it'd be more like, doo. But then pitch level for low may show boredom, pleasantness, or sadness. So it does need to be thought better because we do not want to keep them in this area. And that would be more of doo. Music therapy has been an important part of people's well-being for thousands of years. The use of this medical treatment is not as simple as people may assume, since it still deals with the mental aspect of patients and possibly suicidal thoughts. This explains why the degree is needed, because you are still a therapist. Music therapy has an effect through the entire body and mind, not just among patients, but people everywhere. Whether they are sick, disabled, depressed, we all deserve to be happy. Thank you.
Renee, what did you think? You're not here. All right. I'll tell you what I thought. I like the idea of the opening with just the moment of quiet and the music in the background. It gives us an impact that kind of explains the concept behind what you're talking about, and I think that that works pretty well. It does go on a little bit longer than probably is sustainable for a speech. You're asking people to be patient for a whole minute at the beginning, and we're probably a little anxious talking about emotional reactions for you to get started. So probably I would maybe cut that in half, maybe find another piece that fits in a shorter period of time that would still allow you to do the same sort of thing. I thought you had a very good transition to the start of the speech, and that we know what your topic is very clearly and sort of what the goal is going to be. What I didn't get was as clear a preview of what the supporting structure is going to be, and as I'm listening to it, I couldn't pick out a structure. I did feel sometimes like we were going back and forth between topics, and there wasn't a pattern that I could follow when you were speaking, and I think that that's a little bit problematic. There's one point, for instance, where you talk about the whole section where what some of the qualifications for a music therapist might be, and I'm going, well, why is this in the spot that you're talking about? It feels like it's just a side note that doesn't have anything to do with what came before and nothing to do with what came afterwards. If it's its own separate point, then it needs to be in a different place in the presentation. There were a couple of places where there was some information that's shared that seemed a little bit confusing to me. You make it sound as if the therapist composed the music, and I'm not sure if that's what you meant to suggest. They might obviously decide on what kinds of music to play or to focus on. Maybe they compose some of the music, I don't know. It was just a little bit unclear as to what it was that you were saying at that spot. I did hear some source citations in the presentation, and obviously the visuals, when you get to the second set of visuals, or I guess the main set of visuals, because the other is an auditory aid, when you get to that section, it starts to have a little bit more coherence to it, a little bit more form to it, but there's so much that you're trying to get in at the end that I think that gets to be problematic. I would say if you could maybe take everything that you had in the first half of the speech, condense it down to a very small portion, and then talk about the technical stuff or the emotional things that you're trying to work with patients on, what you're trying to adjust, and how those different kinds of sounds influence patients. You can keep up your brain visual, and then use the second one with the emotional visual on it to explain that a little bit more. As it is, I just feel like I get barely a little bit of information on each of those points, and that was the one that had the most substance to it. Everything else was a little kind of esoteric and general in nature. So I think those needed to come earlier in the presentation, and I think you need to spend a little bit more time on that. All right, I think that's fine. Thank you. And it was long, by the way, right?
Yeah.
Okay.